Hey everyone, it's Dr. Alessandro. Welcome back to my channel. And today's video, I'm going to be doing part 2 of the trauma series. Now, during this video, you're going to be seeing pictures of trauma cases. And what I want you to realize is I don't want you to look or watch this video if you are squeamish, because the trauma pictures that I'm going to show you are fairly extreme. So if you're squeamish, look away, or, well, I don't want you to not watch the video, but maybe listen to the video and listen to my words, but don't look at the screen, because yeah, some of this is pretty graphic. That said, I'm going to start. So in the first case that I'm describing, I encountered a nice young guy. He had just broken a tooth, one of his front teeth, and the tooth's nerve was exposed. So in a case like this, anytime that happens, I pretty much tell the patient automatically, this tooth will need a root canal in the future. Now, this was, to my recollection, I'm almost positive, it was probably about 8 or 9 o'clock at night when I was at the office helping this nice guy with a broken tooth. So I wasn't about to start a root canal at that time. I fixed his tooth. Actually, I fixed it with tooth-colored filling material and made it look a lot like his adjacent teeth. So the result aesthetically was really, really nice. But I told him, look, this tooth will ultimately need a root canal. Well, a year and a half went by, and then he came back and he was in pain. And he had not had a root canal done. So ultimately a root canal was done, and a crown or a cap was put on top of that tooth to fix it in its final form. But yeah, so whenever there is a fracture of any adult tooth, of course, where the nerve is exposed, a root canal should be done. Now, even if there's a fracture where the nerve of the tooth is not exposed, there is always, and I'm going to repeat, always a chance of a root canal needing to be done. Trauma is a pretty unpredictable thing in terms of the long-term results. Sometimes teeth are okay. Sometimes they end up, the nerve ends up dying within the tooth within months. Sometimes it's years, and sometimes it's decades. And I wish there were a way to predict which teeth would react in what manner for which person, but unfortunately there isn't. So once there's a trauma, we just say, hey, we're going to be watching the tooth, and that becomes pretty much for a lifetime. And if it goes on for entire life being healthy, that's fantastic. But my expectation is that anytime there's significant trauma, there's pretty much a 100% chance of the future holding a root canal, for that tooth. So that said, in the second case that I'm describing, we actually have a tooth that has been, displaced. That is, there's actually a bone fracture, and the tooth was kind of pushed out almost entirely, but not quite. So what I did for this young lady, who I believe was 8 years old at the time, I replanted the tooth, even though it was still kind of part way in. I got the area numb. I replanted the tooth. I splinted it to the adjacent teeth. I sutured up the soft tissue injury, and so I stitched it up. And I called an oral surgeon, and the young lady had to have a bone plate placed in to hold things together. Healed up really well, and at the last follow-up, now this is years later. This is actually, at this point, we're at 4 years later. The tooth does not yet need a root canal, and it appears to be still healthy, and it's a slightly different level than the adjacent tooth. So this is one of the front two. Now, we'll be watching this tooth for the lifetime, and I do expect something to change in the future. But we've been taking x-rays over the course of time, and things have not yet shown to have changed by the x-ray and by the physical appearance of the tooth. So knock on wood, of course, this stays healthy, but my expectation is that somewhere down the road, something will need to be done. Now, in the third case, this is really, really important. This is the third case that I'm about to show you in pictures is a case of a bicycle accident where teeth were knocked out. And this is something that I do want those of you who are hospital administrators or maybe emergency room physicians or other physicians, anybody in the medical field that maybe deals with trauma or facial trauma or other trauma, but especially head and neck trauma. I want you all to pay attention, because this is where I'm hoping in the future that dentists and physicians have either a better communication line, or maybe we develop better systems of collaborating, working together as professionals. So in this case, these teeth were knocked out, and now the patient had other facial trauma and injuries. I do recognize that everything else is more important, making sure that that the brain is okay and the patient's other injuries are tended to. Those are critical. And there were some external injuries, lacerations, cuts, scrapes, everything else that were significant and required a lot of stitching. Plastic surgery got involved for this patient. The patient went to 2 different hospitals, so one for the immediate care, then the second one within a few hours for the plastic surgical care to help the facial wounds get closed up properly, which was critical because it definitely required plastic surgery. But what wasn't really addressed at all was the mouth. And so the patient went to 2 different emergency systems, as it were, hospital systems, without really having anybody look in the mouth. And when I got to the patient, when the patient's parents finally called me and said, yes, after everything else, they're ready, what I ended up receiving was a box with 4 teeth in water. And I looked in the mouth and there was still gravel in the mouth. So this is where I want to go ahead and say, hey, medical guys, if you need a dentist on your staff, or you need a consult, don't hesitate to call. Get us involved, because seeing gravel in the mouth after somebody's been to 2 different hospital systems, to me, doesn't exactly reflect too highly on those medical systems. And so, if there's somebody with facial injuries that had teeth knocked out or knocked in different places, not quite the right spot, other intraoral injuries, please consider either having a dentist on staff or developing a consultation system with a dentist, because I think that that's going to be of great benefit for you. So I ended up having to clean out the gravel that was in the mouth, try to replant the teeth to the best of my ability. The teeth were also fractured, so I had to rebuild the teeth to a certain degree. I did root canals on all these teeth outside of the mouth, replaced them in the mouth, splinted it to the teeth next to the empty space, as it were, but told the parents, look, there's pretty much 0 chance of success. I'm just trying to put something there so that there's not a big gap that's visible. But in the future, you will have to plan to do something else, which may include implants or a partial denture or something to replace the missing teeth, whatever it is you choose to do. So that's the long and the short of this particular segment. So, for dental trauma, like I said in the first video, always please make sure that you go to an emergency room or have physicians evaluate somebody if they've been in a traumatic situation or lost consciousness. After that, please come and see your dentist so that we can try to do whatever it is we can to fix the teeth if it's been an emergent situation that involves the hospital or physicians. Otherwise, if you have chipped teeth or a tooth got knocked out and you were not in any kind of an otherwise medically important situation, come to your dentist right away. If a tooth has been knocked out, get it into some sort of fluid. Water is even acceptable. If you have a tooth saver solution, which are commercially available, that's always preferred because it has the right electrolyte balance in there to help a tooth try to sustain its cells. But otherwise, please get to your dentist. We will always try to do everything as quickly as we can to replant teeth and to get everything stabilized for you. And again, thank you so much for joining me in this basic trauma video, and hopefully you're all staying well and healthy.